Hello, everybody. My name's Jennifer Wilson, and I'm a social worker at the Leukemia and Lymphoma Society, which Ryan just told you. And so I'm here today to discuss the patient advocate's perspective of testing for CLL patients within the United States. And so, does that go? The next slide. Oh. So this is just what I'm going to speak about. I'll tell you who we are, and then I have a little story and information from my colleagues in the Information Resource Center. I interviewed a number of them to sort of get their sense on what the patient experience was. And then I did we have an online discussion board, and I did a poll on the LLS community specifically asking these questions. And then I'll give you the results of the poll. So the next slide, if good. So this is the Information Resource Center. We work Monday through Friday. We're open 12 hours a day. We respond to people incoming phone calls, we respond with emails, we have a chat feature, and we also do take referrals from nurses and social workers to call out to newly diagnosed patients. In fiscal year 19, we had 20,000 interactions with blood cancer patients, so it's all blood cancers. But 2,100 of those were CLL patients and family members. And so if you want to go to the next slide. So my story, though, is when I came to CLL Horizons back in 2016 in Serbia, Dr. Stamatopoulos had a lot of sessions, and every single session he said, testing, testing, testing. It has to be done before you get treatment. Before each line of treatment, you need to know. So I went back to the United States, and I then went to ASCO. And ASCO is a big cancer conference in the United States. And there I saw a poster about testing within the VA, or Veterans Administration, within the United States. And Dr. Awani from the Huntsman Cancer Center had looked, and I know they just said not to do retrospective data, but he looked retrospectively to see, were people in the VA system getting more testing since the availability of novel agents? And so he looked, the first group was like 2008 to 2013, and then he looked at 2014 and 2015. And the bottom line was, even though we knew it would make a difference in treatment outcomes, there was no difference in the amount of testing that was going on. I can report, though, I was at a conference with Dr. Awani in 2018, AVAHO, which is a Veterans Hematology Oncology Conference. And in fact, now finally the numbers of veterans being tested are rising. So that's kind of good, very, very good. So I asked my colleagues, what is it that, how does testing come about as part of our conversations? So usually what happens is we start by talking to people about why they called. And the reality is it's usually financial. Like, people call us because they just don't have money to afford treatment, or they're very distressed about a new diagnosis. So we address that, and it's all good social workers. We're starting where the patient's at. And then we try to understand where the patient is. So where are they in the course of their disease? What's their understanding of CLL? Do they know the specific characteristics of their CLL? And what is it that their doctor has discussed with them about it? And so we then educate patients on the importance of testing before each line of treatment. And we really emphasize to people, it's very, very important who treats your disease. We do clinical trial education, we help them develop a list of questions, and then we send them a number of resources and refer them also to other reputable, like Brian, organizations, because we want CLL patients to have the best information possible. So on the next slide, you can see that this is what people identified as what their obstacles were. Because we feel like if we can get someone to a CLL specialist or a doctor at an academic center, they will, in fact, get the right testing and subsequent treatment. But some of the obstacles were people live in rural communities, and the United States is very large, and so some people do not live anywhere close to a center. Sometimes they don't have the financial resources to travel. They're worried that their doctor won't cover a second opinion or testing. A number of patients, unfortunately, in the US are still uninsured. And then there's sort of this emotional component. They don't want to offend the doctor. You know, I mean, like, let's say the doctor hears you're going someplace else. It might be that they won't like you as much and they won't want to help you as much. And so even though I might say, if you go to the right doctor, you will, in fact, get the right tests, the right treatment, you'll be offered clinical trials, they don't want to offend. They also believe their doctor knows best. And you know, in the US, we have people go to hematologists, oncologists. But sometimes people are just really determined to go to the doctor who may have treated a family member 20 years ago for breast cancer. And that's not going to be the best fit, and that's not going to get people the best care. And so we encourage. And some people have been told, you know what, it doesn't matter where you go, everyone's getting the same thing. You don't need to go far, I know what to do. So these are some of the obstacles. And the other thing is that I heard, which I was sort of surprised about, because I have been in this role for 11 years. And so but two people reported to me that patients were told that you're older, you don't need testing. And that people who had sort of worked a lot in Florida, which has a lot of older retirees, but still, I was shocked. So on the next slide, what I did was I said, all right, let me interview. So these were my interview of my colleagues on the last slide, but here I wanted to put a question out to the LLS community. The LLS community is an online, somewhat interactive discussion board. And a few times a week they have what's known as question of the day. And so there's over 12,000 members, blood cancer members, but there's about 1,400 CLL patients who are on the community. And so the question was, did you have cytogenetic testing to know your mutations and specific information about your CLL. And so I had just found out I was speaking very recently, so I didn't have time to really let it play out for too long. But I did get 101 responses within the 3-day period, and 50% said yes, they had testing, and yes, the results were explained to them. Now, one caveat to this poll is that the patients who were on the community tend to be very involved with our organization. So they may listen to our teleconferences, they read our material, they may join our chats. They're involved and they're more educated, I would say. They're a small segment of our general population. So 50% I thought was great, but 11% said, you know what, I had it done, but no one told me what the results were, which I thought was a little surprising. But the most sort of upsetting or whatever is the 27% who haven't heard of this. I mean, because we know that we try to do it in all of our calls. We try to have whoever's providing education include this in their program. And, you know, I guess this 8% down here are going to have it done later. I'm assuming they were probably in watch and wait, and you know they were going to do it at the time of treatment. That's my best guess. And the 4 with not another reason, I don't really know. But this is just sort of this is sort of a snapshot of what I learned from the community. And then on the final slide, hold on, right? I thought about things, they said, what are things that we could be done differently? So I thought if there's a 1-page form that people could fill out, did they get this testing, that they take with them when they're going in to have the treatment conversation, that might make it sort of easy. And you know, it's not that they'd be asking the doctor or questioning the doctor about, you know, are you doing the right test or not? But they would just be following the form. It would take some of the, you know, I don't want to offend the doctor kind of feelings away out of the equation and just make it, oh, was I tested to see if I had TP53? You know, it's an easy way to sort of make that those questions possible. I thought testing should be a topic throughout the organization, and it is, especially tests that are for actionable mutations where you can actually do something different as a result of the answers. We're always continuing to have discussions about getting to a CLL specialist or considering a clinical trial. And we discuss that at all phases of the disease because I think we feel like it really has to be part of the conversation. My other thought is that there are people, and this concerns me, is with low literacy levels. So they really can't read well, like, you know, so after we talk to them for a little bit, they'll say, well, you know, Jennifer, I really can't read what you're going to send, so don't send me anything because I can't read it. But we have to come up with some way to reach that group because, you know, they need the information. And certainly I take the time to talk to them about these issues because just because they can't read well doesn't mean that they shouldn't be as informed about their disease and the treatment as everyone else who calls us. I think that we have to keep offering paper and hard paper materials because a lot of people who are older say, you know, I'm not really good with a computer. You could send me the link, but I'm not really sure I'll be able to figure out what to do. And, you know, I mean, I try to follow up most every call I have of substance with an email that has the links to all the programs and resources so that people have it at their disposal. But you know what? Some people don't have a computer, they don't have a smartphone, so we got to have the paper. And I also think that in some ways there needs to be more education for the community-based hematologist oncologists. Because yes, I could try to get people to the big academic centers, but you know what? If they can't go, they can't go. And so if they're not going, I'm hoping that their local doctor will address it. And also just to address any obstacles that are getting in the way of people accessing the doctors who know the most. I'm done.